Good afternoon, everybody. Welcome. Thanks for joining us for this very important conversation topic on Medicaid. I'm Brooke Lovelace. I'm the Executive Director of the Iowa Developmental Disabilities Council. We do know that there is some confusion on what's actually being discussed around Medicaid. We do hope that you leave here today with a better understanding of what's actually at stake and also important about how you can make a difference and take some action. We do also want you to know that the DD Council is here for you as a resource. And we know it's a little bit kind of trying times, but we're here to help. And to repeat kind of an old cliche, we are all here together. So hang in there. We do have closed captioning here that's available for you guys, and we do have an interpreter that's pinned for you. And I think with that, I'm going to turn it over to our public policy manager, Carlin, who's going to lead our discussion today. And if you can, also just put your audio on mute if you're not speaking. Thank you. Carlin, go ahead and take it away.
Thanks, Brooke, and thanks everybody for joining today. As Brooke said, we hope you come away with good information today that can help you take action or speak out on potential changes that may be happening to Medicaid, both at the federal level and what could potentially happen at the state level, and how you feel about it. So I want to introduce my co-presenter today, Amy Campbell, who is our public policy consultant, and she's a multi-client lobbyist who's been working on issues like this for many, well, that I don't want to give away your age, Amy, but lots of years. She has lots of experience and expertise. So I'm just here to set it up for some things that Amy is going to talk about, and then as far as what some potential changes could be, and then at the end we'll talk about how to take action. And I am going to give you a heads up. We have a lot of slides, and they're very text heavy. We do not expect, and you probably don't even want to have to, we're not going to read through every bullet point in every slide. So our reason, though, for doing that and for kind of adding a lot of information in this is so that you can use this later if you'd like to be able to have something to refer back to. So we'll make the slides available for later. And there's also, contact information in here too that can help you later too. So, so with that, I just want to say that we're going to be doing this as kind of a high-level overview, but because there's a lot of details, we're going to get into the weeds at some point, but you don't have to remember all of that. Our purpose today is to give you some good information and then help you take action as you would like to take action. So if you take action in any way, shape, or form, then we did our job today. So I'm going to start by talking a little bit about Medicaid and what its impact is on Iowa and Iowans. This is data from some of it is from the Kaiser Family Foundation. The KFF has put out Medicaid fact sheets on every state. So if you see these nice graphics, they come off of these fact sheets, and we have the link to them in here too. But also some of our data comes right off the Medicaid dashboard. And the dashboard is real-time data, whereas the Kaiser Family Foundation information is a few months old. They published it in August. So if you see some points where it's like these two things aren't matching up, it's because we're using some of the real data from Medicaid, which includes that right now over 700,000 people in Iowa are covered by Medicaid, which includes Hawkeye, which is for children. And that is 21% of Iowa's population. 40% of who is covered by Medicaid, actually between 40 and 50%, are children. And so that's why it's the top of this list. But as you can see here on the left, the bullet points, these are the people who are typically covered by Medicaid. And then the graphic gives you some ideas of what that means as far as kind of percentages. So 3 and 8 people with disabilities, and we're going to talk pretty specifically today about people with disabilities. And with that, 37% of people with disabilities in Iowa rely on Medicaid. And most of that is going into long-term care supports. So that could be residential care facilities, intermediate care facilities, that's what some of those acronyms are, and nursing facilities. But one of the things we really want to point out today is that for many people, Medicaid is their only option. It's their only option for healthcare. It's their only option for personal care in the home, long-term care supports, and long-term care doesn't just mean seniors or elderly. Long-term care starts when we understand somebody who is disabled and is going to need care over the lifetime. And the reason it's the only option is because even if private insurance is available to you and you can afford it, it doesn't cover all of the needs that people with disabilities, whether it's physical disabilities or intellectual, developmental disabilities, and private insurance doesn't cover all of those care needs and supports. So that's why Medicaid is the main funding, or not, doesn't have to be the main funding source, but it is a healthcare, the only healthcare option for many people. It is the main funding source for much mental health care in Iowa, which we I'll talk about a lot. So also want to emphasize here in the first bullet point, and we're going to come back to this in another slide, but Medicaid, is funding services that allow children and adults who would otherwise have to live in an institution to live in their community. So when we're talking about home and community-based services and the supports that people need and waivers, this is what allows people to be able to live either with somebody in their home and get care, or live independently instead of being in an institution. And again, we're going to come back to that because it's important. But it's also medical care and health care for many people, which includes therapies, hospitalization, dental, and again, personal care services. And something that a lot of people don't realize is that when students in school, and this is our third bullet point here, need therapies and other supports to help their health and to help keep them healthy so that they can learn, that some of that is funded by Medicaid. And that kind of came to light last year and this year as we talk more about how the AEAs play into care services and supports for students, I should say, with disabilities. And some of that funding comes from the AEAs and some from Medicaid. So back to home and community-based services, and talking again about how Medicaid supports help people live in their community. These are all the home and community-based services programs that Medicaid supports. So the waiver program, which right now is 7 waivers. Some of you may have heard that that's changing. And that's under a new program called HOME, which is not up here, but that's another program we could spend some time talking about. We don't have it on our list today. Habilitation services, elderly home health, personal care again in the home, hospice, case management. Money follows the person, which allows people to move from institutions into the community and keep the service and funding that they would have to use in the community rather than use it for an institution, as well as training. And so, as you can see, it covers a lot of things, which most people don't realize how extensive this part of Medicaid is. And what we'll bring up later is that this part of what Medicaid covers is optional for Iowa to cover. So this is a great thing that Iowa, the state of Iowa, our government has put in place for Iowans who We want to have living in the community and living as independently as possible, but that requires Medicaid support. So to break it down as far as, because we're going to talk about federal funding, where does all the money come from? And it's a lot of money. And in fact, we didn't put the total in here, but it would shock you. A lot of funding for Medicaid comes from the federal government. And you probably hear sometimes that there's a match. So for every dollar that Iowa decides to spend on its Medicaid program, usually it's the federal government matches it by $1. But it's different for every state, and it depends on the population, it depends on the needs of the population. And so it's very hard sometimes to say, if you're talking about Medicaid funding across the country, how much the federal government is contributing. But in Iowa, we know that the federal government pays 63% of our costs for Medicaid, and the state is coming in with 37%. So that's, 2/3. And so when we start talking about federal funding cuts that have been discussed, that starts to get a little scary. And so that's why we're here today. And the way that those percentages come and go is based on, again, the needs of people in our state, the population and how it changes. And as you can see here, what this graphic is showing, and I apologize here, I had the KFF reference point on here, and it is later in the uh, slideshow, so I'll point it out where these graphics are coming from. But this is the percentage of people in each state who are covered by Medicaid. And so here's where there's a little bit of a discrepancy of it because of time. So it shows here that Iowa is under 20%. And as you saw from the previous slide, we're at 21% now because the number went up. We went up to 700,000. We were at like 680,000 in last fall. So, we're still kind of in the lower percentages of how many people in our state are covered. So the darker states here would be the ones that have the highest number of people who are covered by Medicaid. So that just kind of puts things in perspective of, first of all, where we stand as far as other states, but also kind of where the money is flowing. But the states that are darker, it doesn't mean that they're getting more federal dollars, because the percentages are a little bit different, more as far as percentage. They could be getting more if their population is higher, which is would be true for California, we know. So again, if you are a data nerd and would like to dig more into comparisons to other states, we'll give you that link to the KFF Foundation, because it is very interesting to look at other states. So again, why we're here today is to talk about some ideas and some ideas that have been floated about how the federal government can save money and be more efficient. And of course, we want to promote efficiency. But one of the ideas that is floated has been to reduce funding for Medicaid. And so they have some ideas that we have heard about and are going to go into those a little more detail. But some of them have come out of the Project 2025. The Paragon report is another kind of conservative think tank that has come up with some of these ideas. And we know right now that our members of Congress and Congress, both the Senate and the House, it starts in the House though, have been talking about these ideas. And what we want to talk about is if they do make these cuts, how it could affect Iowa, the state of Iowa, and how it could affect you. So I think this time it's Amy's turn to come in and go into a little bit more detail about these ideas that are being floated. And I think the next slide, which is coming up here, yeah, shows you 8 that we'll be talking about. Again, these get kind of into the weeds. There's a lot of text, but I will say the first 3 really focus on how if federal funding is cut, how this could affect the state's budgets and the state. So it's kind of effect on the state. 4 through 8 are a little bit more what a direct effect it could have on people. So everybody's going to be affected at some point by the cuts in 1 through 3 also, but it's a little bit more direct effect on an individual rather than on the state budget. So I'm going to turn it over to Amy and let her do the hard part here. But I'll chime in too if I know she's not going to miss anything, but for her to support too.
Oh, I'm sure I might miss something. So that's why we have a team, right? And so I just wanted to reiterate that the things that are done on the federal level will impact what happens on the state level. But it's important to also note that both federal and state, your elected officials on both state and federal have a piece of this decision making. So what happens on the federal level comes down to the state, and the state then has to decide whether it's important enough to invest more state dollars to make up for what the feds may have decided to do. And so I want to reiterate some of these things, like work requirements are going to be discussed at the state level as well. But they're really the only thing you can do to cut costs are either make people healthier and then therefore reduce the cost at the higher, more costly services, limit who can access the services, or change what services are covered. So, I mean, all of those things obviously have an impact on the individuals who are currently receiving them or might be needing additional services that aren't even being discussed right now. And so we'll talk about each one of these real quickly. The first one that I also want to add, nothing has been decided, so nobody panic. I want to just add, I think Brooke said that at the beginning. We're all in this together. We're all trying to piece together what is happening between what's being said and what's actually being introduced. So again, none of this is happening, but people are talking about it. And so it's a good time to get in front of this and talk about the impacts that could possibly happen if Congress were to take action on one of these items. So one of the ones that we've heard repeatedly talked about is Medicaid block grants. I personally think this is probably the hardest one for legislators because they're all going to be looking at their individual state and whether they come out ahead or behind on this. The block grants really mean that the state is going to get a set amount of money, federal money. Right now, we draw down the money based on what our policies are. So it's a required fund. So the state and the feds pay what it costs to provide the services on our menu. So it is, in essence, not really capped. It's not a set amount. Block grants mean we're going to give you a set amount of money, and when you run out, you run out. So that means that the federal money stays the same, even if the costs go up or more people use Medicaid services. So I think Carlin came up with this analogy. I think it's great. It's like a box. If you look at the block grant as a box and you put the money in the box, and when there's no more room in the box, that's it. There's no, all the programs and services have to fit into that box. If they don't, there's not going to be funding to pay for them. So again, the states can cut costs. If they do a block grant, they have another number of options, and that's where the state decision making comes in. If the federal government decides to do this, the states can make people wait for Medicaid services, so waiting lists, which we have 26,000 last I checked on waiting lists. That may be duplicated people, but that's the number right now. They can make it harder to get Medicaid services. Maybe you have to do more things in order to get it. Or they can change the way health and long-term care, what kinds of services they can get. What's that menu that's allowed? So if there are more people than costs to fit into that box, the state's going to have to make that decision. How is it going to cut costs? How's it going to live within that budget that they have from the federal government? Right now, the federal government says we have to pay for certain services like residential care, nursing homes, emergency services. You can guess that those are the most costly services in the system. So right now, our federal Medicaid law requires us to pay for the most expensive stuff, but not the less costly things. So that's important. That could change if they change and make changes in the law. These services are very high cost. They'll take up a lot of room in that box. So the more state spends on high cost institutions, which we've been trying not to do, the less money there is for everything else, like home and community-based care. Again, that's just kind of another showing of what kinds of services are mandatory and what kinds of services are what they call discretionary, optional services. So things that the state has decided they do because it's the right thing to do. And we want to remind everybody, I think everybody on this call knows that community-based services are the things that keep people out of the high cost institutions, out of the mental health institutions, out of the emergency rooms. Some Medicaid programs allow people who would otherwise live in an institution to live in the community. And block grants could lead to more people being served in more restrictive settings. We say could. There's a lot of things that will go into this in these decision making that we don't know yet. So that could be an impact. The other option is to decrease the amount of federal Medicaid match. So we've heard a lot of this. Right now, it's a weird formula that's based on things like unemployment in your state, cost of living. There's a number of factors that go into what the Medicaid match is, and that changes every couple of years. Right now, Iowa's at 63%. It's changed. Our economy is pretty good. So our Medicaid match may not be, the highest in the nation because others may have more poverty or higher unemployment costs. But right now, that is our Medicaid match. So they could look at either lowering the Medicaid match or looking at different factors. One thing I've heard of criticism is that it rewards states that aren't doing a good job in their economies because they would get a higher match on the federal side. So there could be looking at the formula, looking at the things that look at it, or just arbitrarily going in and saying we're going to reduce the current match by 10%, or we're going to just do a across the board 50-50 sharing. So that we'll pay half and you'll pay half. All of that is going to mean less money for the state and more money we're going to have to come up with at the state level to keep everything exactly the same. Or we'll have to make changes on what we cover, who we cover, and how we cover them. The third option limits how much money can be spent on a person. So maybe you just take in a lifetime cap, which you have in private insurance, or a per person cap. And obviously that's going to hit people who have disabilities that are not going to change over their lifetime, that they're going to need that level of service across their lifetime when somebody else may only have an appendix and have to use more one year, but then not the next year. So I just want to, both the per person cap, so like an annual cap, or a lifetime cap would limit the amount of Medicaid money that can be spent on a person. And we kind of explain the difference. A per capita cap would be a total amount that each person would be able to spend in 1 year. It may or may not count for the changes in need or increases in costs, depending on how they decide to do it. A lifetime cap, you get one bad thing happen to you and you could spend all of your cap in a year. My brother, who has Crohn's disease, did that with his private insurance, and he has great private insurance and had to get another insurance policy, which was not easy for him. So, and he was in his 30s when that happened. So a lifetime cap means you got this amount of money to spend in your lifetime. When you're out of it, you're out of it. People with intellectual disabilities and developmental disabilities, which if you see on our slides is IADD, have support needs that are across their lifetime. So that could be difficult for individuals with disabilities. Sorry, I hit a button and it moved ahead or behind or somewhere. There we go. So states only have a few ways to reduce their Medicaid costs. When we're talking about what states might have to reduce their Medicaid costs, we're talking about changing who can get into Medicaid. It can make it harder to get in. You could stop covering some groups of people. You know, it might be maybe we decide we don't want to cover, I don't want to even say a population, I don't want to scare anyone, but kids, we're going to stop covering kids. Now, obviously, I don't think anybody's going to do that, but they could decide kids are pretty young, they can all go on private insurance. Or we can decide we're going to just, I mean, we're talking about combining waivers. We could decide, nope, we're just not going to cover people with brain injuries. Or, you know, they can make some decisions, some they can't, because Medicaid laws right now won't let them discriminate, but some do. Some laws do allow some of that picking and choosing. So you can make people wait on waiting lists, which is what we're doing now. It'll just be bigger waiting lists. You can limit or get rid of services and supports. So maybe we don't cover transportation. I have heard many people say Iowa's Medicaid benefits are pretty good compared to other states, that we have a pretty full list of benefits. We could look at what other states do and decide, we're just not going to do those other things. Again, those other things probably keep people in the community safely and out of higher cost care. We could set up tiered benefits. So maybe you have higher level needs and you're going to be in this tier of services, this level that you're allowed. Or we might have, if you don't need a lot, we might, you know, if you're a healthy kid, maybe you just need preventive services. You could cut how much the state pays care providers. Not a fun topic, because those are the people that are already struggling to keep workforce because of low wages. I think we all know what happens when you cut pay to providers. It means less access and more turnover in staff for doing pretty personal care. And you want to have the same provider. You could add more things for people to do, like cost sharing. That means like if you have, every time you go to the doctor, you have to pay $5 or $10. Or maybe you have to pay up to a certain amount of services before you get the free services. And you could make people get permission before they get care. Like they call that prior authorization. So maybe you have to jump through more hoops in order to get the services you need. And we're already trying at the state level to get rid of some of that stuff, right? I know during the Work Without Worry discussion at the state level, we talked about, you know, all the things people have to do to get a wheelchair fixed. So I know some of that discussion's already happening, and we could go backwards and just require that for more services. We could also do Medicaid work requirements, which I think are being discussed at the state level too. It was in the governor's recommendations that we have work requirements. Now, there might be people that are exempt. Usually there's a list of people that maybe are full-time caregivers, or they have a small child at home, or they are a person that just is unable to work, and that condition is likely not going to change. But what we do know is that a high percentage of adults, Iowans on Medicaid work. And the question is, how are they going to prove it? And in the proving of it is when you usually lose people. That's where your savings is in making people who are already have a lot in their lives have to go through more paperwork, remember deadlines, and get information in. Whether or not the state already has that information, require them to provide it again. And that's where you start to lose people, is if they don't get a letter in the mail, they don't remember a deadline. I do that every session. I forget to pay a bill or do something because I've just got a lot on my mind. And then it's hard to correct those mistakes, and then you lose those services. And often people forget that paid and unpaid family caregivers are also on Medicaid, so it can have a bigger effect as well. So you can see 75% of adults in Iowa are on Medicaid and working. And I think that's important to know. And then just more of the impacts on Iowans with who are on Medicaid. You might not meet the work exempt requirements. And when we talk about work requirements, I also want to mention that usually what's included in that is if you're in education, if you're doing, if you're going to college, or you're going to a training school to learn a trade, or some other thing that is going to allow you to further your career. So get jobs in the end. So that's also usually included in that. And so I think if you, I think the last bullet's probably one of the most important, is people who don't have technology, may not have a computer, because usually you have to submit things electronically. If you don't drive, if you're ill or alone, or you need plain language and clear steps to follow to complete the tasks correctly, you might be more at risk of losing services. And I think that last part is really important. I've seen some of what you have to put together. I don't understand it most of the time. It's hard to follow. And if you're busy, it just adds to the frustration, worry, concern, stress that families have. Number 6 is change what is covered under the ACA. And I want to mention that ACA is the Affordable Care Act. Some people call it Obamacare. And that is what requires people have access to insurance that's affordable to them, whether or not they have a job. So that means everybody can get the insurance that they need. It's not always as affordable as I think what people want or expect, but there is an option for people that can get lower cost insurance. But they can change that. We call it in Iowa the expansion population. You might hear people talk about that, or the health and wellness plan is expanded Medicaid, but then there's also the marketplace plans that you can get. And so before we had that law passed, we had 2 real problems. People were denied coverage because of what they have, conditions they have, and they were denied medications that really were helping them live, or those medications were so expensive, there was just no way they could ever pay for them. And so the Affordable Care Act was intended to help more people get access, so that we so that the overall cost of insurance for everybody doesn't continue to go up by double digits every year. And so you can see some of the coverages that are available, but changing this could just mean that more sicker people won't have access. which then costs everybody in the system more. And moves more people out of private insurance and into Medicaid eventually. The seventh option that we had listed was stopping federal money that lowers ACA, Affordable Care Act premiums. So this right now, when the Affordable Care Act was passed, to get states to do the expansion, they started giving the states a 90% match. They also help pay down premium costs. So depending on where you fall, whether you're in the expanded population of Medicaid or you're in the marketplace plans, and this gets weedy, I know, but these are different options for people depending on their income level. The bottom line is that funding is set to stop in the end of this year. If Congress doesn't act to continue it at this rate, that means premium payments could go up by 75%. It's huge. That probably means a lot of people will dump their coverage because it just won't be worthwhile to them. That means people get sicker and then they use the higher cost services when you're, like emergency room care. They'll wait till they're so sick they have to go in. And people with disabilities have a outsized impact on this. So people that are on these plans will be impacted. Many paid caregivers do not have employer sponsored insurance. A lot of them have these plans that they buy on the marketplace. So they're too much, they earn too much. I think it's over 133% of poverty. They earn too much. So they're going to buy their plan on the marketplace. And if they can't afford those, or if the cost of that goes up and they're on these low pay, they're not being paid richly for being a caregiver. That just means higher costs into their budget, and they'll have to make the decision whether it's worth it to keep it. Many people will have to decide between their rent, feeding themselves, and that. So, low wages and low value benefits are the main reason why care workers leave their jobs. So any other pressure we have on people that are providing the services means less access for people with disabilities. The lowering or stopping federal funding for the expansion population. So this is the individuals who have expanded Medicaid. We call it the health and wellness plan here. To entice, this is where I mentioned to get the states to buy into this and do this, the federal government gave a better match. So 90% of the program is funded by the federal government. When it first went into place, it was 99% and it's gone down to 90%. But that's a big jump from the 63% we mentioned in the rest of Medicaid. So this is, you can see on the states, almost all of the country has done Medicaid expansion. Iowa was pretty early on in doing that. It lowered our uninsured rate hugely. I don't have the percentage, but I know that it was a big drop in uninsured. All but 10 states have let people earning that 138% of the federal poverty level. Sorry, I said 133 before. It's 138% of Medicaid. And so this is a great benefit for people who are working and struggling to get insurance and pay insurance on their own. The impact on people with disabilities, again, is removing the financial incentive to continue to provide services to that population. If we lower that percentage, will Iowa continue? Will Iowa put the money up to make up the difference, or will we drop that entirely? That'll be a question for state lawmakers if the federal government decides to do this. I'm going to turn this over to Carlin because she's going to talk about what you can do to take action on these things, even before we know what they're doing.
Thanks, Amy, and great job covering all that. I just want everybody to know that we are monitoring the chat, and if we're putting in questions there that we can answer in the chat, then that we're doing it. Some we're going to save till the end. But so if you have any specific questions about those ideas, please put them in the chat or save them for the end. Did want to point out, because somebody messaged me, that the discussion about block grants has probably been the most popular lately. And sometimes you hear, oh, it's not a big deal because that's how most programs are funded, is through block grants, right? Federal, getting federal funding for programs. But those kind of programs don't mean healthcare. And people's healthcare needs differ and change. And so that's why the way that Medicaid is funded now makes a lot of sense, because you're helping to support people's healthcare needs as they happen. Whereas a block grant could restrict that, unless it's a huge block grant, but that's, not the point of making cuts. So just wanted to point that out and emphasize that from the ideas that Amy had talked about. So what we want to talk about next is, what you can do if you feel like you want to speak up about what could be happening to Medicaid. It's never a bad idea to talk about what Medicaid has the way Medicaid helps Iowans. And it gives people health insurance that they may not have. It gives people job supports that they may not have. Some people may not even know what Medicaid is doing for that. I can speak to that personally. My son is on Medicaid and a waiver. He's 30 years old. If I asked him, wow, how does Medicaid help you? He would be like, I don't know, is that card I carry in my wallet? And so, we need to, do a little bit better job maybe about talking about why we have these things, and that our state makes them available to us, some of them on an optional level, and that's good. But otherwise, and this is a case for many, is that it's the only healthcare insurance and support that they can get. So personal stories are what's important for people to hear, for lawmakers to hear, for people who are in positions to make change, need to hear from individuals that are affected. We can tell your story if you tell it to us, but it doesn't have the same impact. So helping lawmakers and decision makers understand your experience is what's important, and your voice is important. And stories are going to be remembered more than anything else that we have to say today. So we're going to give you some ideas about how you can share your story also. If Amy will click the next slide. So think about how, how Medicaid impacts your life. And this may be something that you need to ask yourself or your son, who would not know. It gives you access to doctors and therapies and dentists, and maybe covering your mental health care supports. Does it help your child who's in school? Does it help you get personal care? And there is, a comment in the chat that sometimes it's not covering what everybody needs right now. And that's, think how that's going to affect people if you're not getting the care that you need right now and more cuts are made. How will that affect people who are relying on those supports? And a lot of people don't realize that we were talking about job requirements for Medicaid coverage. Medicaid helps people with job development and job training, along with some of our other workforce programs like vocational rehabilitation. Medicaid plays a part in that also, as well as helping people with transportation, getting to medical appointments. So there's so many ways that it impacts people's lives, and a lot of those stories need to be told. and to the right decision makers. So who do you tell your story, Medicaid story to? Everyone. Of course, we're here today to talk about how to reach your policymakers, your decision makers, but it's not, you should not be ashamed to tell anyone that you or your child or your family member or your loved one is on Medicaid. Because as we said, sometimes that's the only option, and it is providing support that you're not going to get anywhere else. So talking to decision makers, here's kind of a quick way to kind of put together a quick story, and having them be concise, having your story be concise, and your ask be specific is very important. So introduce yourself and make sure when you are talking to a policymaker or decision maker, and if you are writing an email or leaving a voice message or sending a letter, that you make it known that you're their constituent. They want to hear from constituents, and what connection you have to disability, and that you would like to talk about Medicaid and Medicaid funding, and then share your personal story. How does it affect you now? If you're not getting the supports you need, talk about that. They need to hear what's happening right now. And we hear these stories that funding could be better than it is right now, and so talking about cuts could be really hard. It is really hard. So how does Medicaid and whether it's home and community-based services specifically, how do they help you live in the community or get the supports that you need to live independently? And then make sure you're making an ask. Don't forget to say, we don't need more cuts to Medicaid. We need people to be supported if this is the only option that they have to get their needs met. So everybody, legislators want to hear from their constituents and know what the problems are, because they're problem solvers. That's what they're hired to do. So don't be afraid to tell your story. And there's several people you need to tell your story to. So we've talked a lot about what's going on at the federal level. So obviously, contacting your member of Congress should be the first people you think about. And actually, we all have 5 people who represent us in a legislative capacity at between both the federal level and the state level. So we all have 2 U.S. senators, and in Iowa, that would be Joni Ernst and Chuck Grassley, and we're going to put up contact information for that too. We have each have a state senator, and we each have a state representative. And I forgot a member of Congress too. We each have a representative in the House of Representatives in Congress. So there's 5 people that are key to knowing you and knowing your story and knowing how you feel about this issue. And ideally, we should be building a relationship with these people who are making decisions about our lives and how things affect us. At the very least, we should know their names, and also put their phone numbers in your books and in your phones and their email addresses. And of course, they want to hear from you, but they don't want you to be a pest. But make your voice heard and show up at their events and ask questions, and know that you're there also as a resource for them to know more about what's affecting people with disabilities. So think of yourself as a resource as well as a constituent, and that you're educating them on what's going on in your life. So here's our 2 senators, Senators Grassley and Ernst, and you can look up their information at senate.gov. We're also going to show you how you can find all of this information on our website, and how to contact people easily. We have 4 representatives who represent Iowa in the U.S. House: Randy Feenstra, Zach Nunn, Marionette Miller-Meeks, and Ashley Hinson. And you can see their districts there. You can figure out which one is yours very easily at house.gov. That's a pretty easy website to get to. You can find out who represents you by entering your zip code, and it will direct you to who your representative is. So for the first thing you can do, quick and easy way to take action today, there's a hotline called Hands Off Medicaid. And this actually launched yesterday. All you do is call this number, and it directs it's a smart app that directs you directly to who your representative is in the U.S. House of Representatives. And you can speak with them directly or leave a voicemail. I did this yesterday when it kicked off, and I was able to get into my representative's office immediately. And I just said, I'm calling about Medicaid. I'm concerned about cuts, and I would really appreciate if my representative would not consider cutting Medicaid and protect it for the people who need it. It was very quick and easy. They said, thank you. We're getting some calls, which is what you want to hear. And they appreciate you reaching out. So that's something that you can do very easily today. And I would ask you to do it as soon as you get off this call, or if you're bored, get on the call right now and do it. The next thing is how you reach out to your legislators in Iowa. As we said, you have one senator and one representative. They decide what state dollars go into Medicaid, and they're going to potentially have some more decisions to make if cuts are made at the federal level. So let them know, just like you will your members of Congress, how your Medicaid coverage affects you. This is the kind of guide to the Iowa legislature and U.S. Congress that Amy does an amazing job putting together every legislative session. In it, you can find all of these individuals that we just mentioned. We'll also put the link to it in the chat. It's not in print version yet because there were a couple of special elections that happened that we're still waiting for finalization on those to make sure it's accurate. But it's online, and we update it as updates happen. So again, it's a great resource. So other action items that you can do from here. Again, talk to your friends and family, get your Medicaid story ready. Again, it can be very concise. It should be very concise, quick, easy. Sometimes our stories are long, but the best stories are the ones that are easy for people to understand. So consider that also. With a solution, a solution is also hopefully not cutting Medicaid, but if there's other issues that you're having, it's a time to bring it up too. So contacting your members of Congress is really crucial this month because they're going to be discussing this. They already are, and trying to make some decisions. We've already heard that because they're getting a lot of calls, they're rethinking things. So that's good, but that doesn't mean we can back off. So you can phone, email, set up a meeting. You don't have to go to DC. Everybody is home in their district. They're going to be home the week after next, and also in the middle of March, the same week in March 17th. It's a great time to meet with them while they're home, but you can also meet with their staff in their district offices, or you can do it by Zoom. So they're very amenable to meeting with constituents, and that's their job. You can contact your state legislators after that. We gave you the information of where to find them. Again, same thing, phone, email, ask for a meeting in your hometown, or where their hometown is would be close to in your district, or come to the Capitol if you have the opportunity. We would love to host you and help you get around at the Capitol.
Quick question. Prefaced by this, I got an email from Enterprise. Van in Mason City's in for some work.
I think somebody needs to put their mute on. Okay, I think we're good. Did I miss anything in that last one, Amy? Now we're running out of time.
Nope, I think we are done and we have 4 minutes, 5 minutes for questions before we lose our interpreter, so.
Got it. So yeah, we're not the only organization that has information on how you can take action. You're probably hearing it from other places. It's great. You know, everybody's kind of coming together on this issue. There's other disability organizations that are providing information in ways that you can contact legislators. So lots of people are doing it. You can do it too. Please reach out if we can help. And with that, we'll take questions.
Yep, or any, and Carlin, let's you and I saved the chat. We will look at the chat and see if there's any questions we can answer, and we will maybe put together some answers to the common questions we see here and put it in our weekly report, maybe next week.
Amy,
So.
could you go back to the screen that has the hands-off Medicaid? Somebody would like a flyer, but I was thinking they could just take a screenshot of it. You just went by it. There you go. People could take a screenshot of that and then you could share it.
We could probably, I will put this on the Facebook, Infinite Facebook too. I'll screenshot it and put it on there.
Yeah, I'm sure on social media.
Yeah, I think it's on our page too already, actually.
All right. Other questions, quick questions people have? I know we probably all have questions. We will be back next week at noon for our half-hour capital chat. So if you come up with questions between now and then, that's a good opportunity to ask us. Carlin and I and Brooke will all be on that. And again, I will take a look at all of these questions. We knew it was going to be tough to get through all of this, but we really felt it was important to have some action items for you too, because I think that the ending note I want to leave with is that nothing has been decided. There are a lot of ideas out there, and now is the time to start advocating because you're ahead of it. Maybe we can stop them from doing something if we talk about the harm that could be caused. And maybe gear toward more something that will be helpful to people. So, all I have.
Thanks, everybody.
Yeah. Sorry.
Yes, thanks everybody for joining. And again, please feel free to reach out to us at the Iowa DD Council if we can help you with any of your advocacy. Check out our website, ddcouncil.org. Check out the guide to the legislature or who represents you. And we hope to see you again on another call. You can keep up with us every other week on Fridays at noon. We do a capital chat. This was the extended version and a very special edition. So.
And thanks to our interpreter for being with us today too.
Thanks, Maggie. DD Council rocks, she said. Woo!
We should get a t-shirt. That should be our new t-shirt.
I like it.
Have a good weekend, everyone.
Thanks, everybody.